Good morning, friends. Thank you, Dr. Rakesh, and for the kind introduction. So, I've been given a topic which is quite challenging because one, it is a new study which was presented at the IDEC sessions 2 weeks back, and the presentation is not there anywhere. So, I managed to jumble up some information, and also, finally, thankfully, Shashank gave me some slides of the results. It's an interesting study. The preview is basically prevention of diabetes through lifestyle intervention population studies in Europe and around the world. I don't have any disclosures for this presentation. The aim of the study is to identify effective way to prevent type 2 diabetes in pre-diabetic population by gathering evidence from two components. One is the population studies and second is the international randomized controlled trial. So, in this I am going to speak about only the randomized controlled trial. The basic hypothesis was based on the results from Diogenes trial, which based on which the hypothesis was that a high protein plus low GI diet combined with an initial weight loss would be more effective than a moderate protein plus moderate GI diet combined with initial weight loss in preventing diabetes in patients who are at high risk. And the study also evaluated the benefit of high intensity short duration exercise versus moderate intensity longer duration exercise. So there were two components, one was diet and one was exercise. And according to the original estimates, a low calorie diet followed by a standard dietary approach would be associated with approximately 16% incidence of diabetes, and a high protein low GI diet would be possibly associated with about 10.5% diabetes. This was the basic presumption at the onset of trial. The subjects were randomized and stratified by age into 4 arms in the sequential manner. They were not random manner, there was a sequential recruitment. And the trial was, at the beginning of trial, there was 2 months phase where all subjects were, given a low calorie diet, and they were supposed to lose at least 8% weight. Only then they could move on to the subsequent second phase of trial. So this is the largest lifestyle intervention trial, multinational trial, which looked at prevention of diabetes. Originally, 2,233 patients were enrolled, of which 2,200 actually lost weight in first 2 months and moved on to the second phase of trial. At the end point, only 962 patients were in the trial. So dropout rate was almost 57% at the end of trial. So this is the largest randomized controlled trial to date on prevention of type 2 diabetes through diet and exercise. And participants were recruited between August 2013 and March 2015 from 8 intervention sites in Europe and Australia. There were 2 diet strategies, high protein, low glycemic index diet and moderate protein, moderate glycemic intensity diets. And there were 2 physical activity strategies, moderate physical activity of longer duration and high intensity physical activity of shorter duration. Inclusion criteria was that patients should be overweight, BMI should be more than 25, age should be between 25 to 70 years, patients should have confirmed pre-diabetes according to IDEC diagnostic criteria, and patients should be willing to be randomized to one of the trial arms. So participants were recruited, randomized to 4 groups, 2 groups with high protein, low glycemic index diet, one in the high intensity low duration exercise, one in the moderate intensity longer duration exercise. Similarly, moderate protein, moderate GI diet into 2 exercise groups. So this was 2 by 2 factorial design. Group 1 high protein, high low GI with high intensity exercise. Group 2 high protein, low GI with moderate intensity exercise. Group 3 moderate protein, moderate GI with high intensity exercise. Group 4 moderate protein, moderate GI with low intensity, longer duration exercise. Initially, all patients were given low calorie diet, and they had to lose at least 8% weight. Average weight at the onset of trial at the time of recruitment was 100 kilos, and out of 2,233 patients, 2,200, almost 97% I think lost weight and moved on to the second phase of trial. So this is the milestone of the trial. If you see, initial 2 months phase of weight loss, and then follow-up phase which lasted 3 years. After 3 years, only 4% of those patients who remained in the study were diagnosed with type 2 diabetes. So 96% of patients had no diabetes at the end of trial. There was no difference between diet or exercise regimes, and the estimate was that if there was no intervention, possibly 21% of the patients would have got diabetes. So there was significant reduction in the estimated incidence of diabetes in this trial. So this is a graph showing difference between high protein, low GI versus moderate protein, moderate GI diets. There was no difference as far as the outcome was concerned before adjustment for other factors and after adjustment for other factors, and probability of not getting diabetes was very high whether you were on low GI diet with the moderate protein, or high GI, low GI with high protein, or moderate protein, moderate GI diet. Similarly, with the exercise groups, there was no difference whether you were performing high intensity, low duration, or moderate intensity, longer duration exercise. And if you look at all the 4 factors, again the differences were not statistically significant. There was initial reduction in body weight across the group, which was sustained during the trial, and the change in weight again was not different between different arms. There was reduction in fasting glucose, there was reduction in postprandial glucose, insulin levels, and A1C levels, which was again, through the trial, similar in the 4 arms. But at the end of trial, towards the end of trial, there was a tendency to all these parameters to go back reverse in the upward direction. That is why possibly we need a longer term follow-up of these patients to actually decide what kind of benefits will be sustained. So why the results were comparable? One possible reason is that all patients in 4 groups were initially given the weight loss. They were put in the weight loss induction, and they all lost about 10.7 kg, 11 kg body weight before the trial started. Actually, the maintenance phase started. So they had very similar profile at the onset of trial. But trial also observed that lifestyle changes are notoriously difficult to keep. Only 43% of the patients remained in the study at the end. And this highlights the importance of coaching and support for ongoing maintenance program. So to sum up, type 2 diabetes patients were far less than expected. Only 4% got diabetes. So 96% patients were free of diabetes. As far as the anthropometric measures to our glucose or insulin were concerned, they were very similar across the groups, and they remained similar throughout the follow-up of the trial. And there were no significant differences between 2 diets, 2 exercise, or combination of 2 diets and 2 exercise, randomized to 2 different groups. A high protein, low GI diet was not superior to moderate protein, moderate GI diet in prevention of diabetes, which is commonly, thought as one of the important factors. I think this is all about the trial that I had to discuss. Thank you.